Welcome, Arlene. Thank you for coming to share a little bit about your birth story with us today. So the first thing is, when you fell pregnant, how did you feel about birthing, given that this is also your second baby?
Yes, for me, giving birth was a small part of a much bigger picture. So I didn't want to become fixated on how the baby was going to arrive. For me, it would have been either elective section or VBAC. And early on in the pregnancy, I didn't want to think too much about which of those options it would be. I just wanted to, enjoy the pregnancy and see how it was going, and hope that, one of the options would present themselves as more favourable than the other. But saying that, at the same time, I wanted to understand more about elective sections, and I wanted to understand more about VBAC, so I could make an informed choice when the time came.
Yeah, good. So as you were perhaps preparing for both eventualities, what things did you do to prepare yourself for giving birth?
So the first thing I did was book on to a pregnancy yoga.
Yes, good.
Because I'd enjoyed yoga when I wasn't pregnant and after my first pregnancy.
Yeah.
And I wanted that time in the week to myself. So I knew on a Wednesday evening I had a couple of hours to myself, could stretch properly, have some time for me, and also meet other mums who were expecting their babies as well.
Yeah.
So I had my pregnancy yoga, and as the pregnancy was progressing, I was reading some hypnobirthing books, and I downloaded some relaxations and meditations that I dipped in and out of as the pregnancy was progressing.
Good.
I also suffered from pelvic girdle pain.
Yes.
So I saw a physiotherapist and a chiropractor to keep my pelvis as strong as it could possibly be for when the time came to give birth. And then immediately before I went into labour, the day before, I saw a reflexologist, and I went for maternity reflexology.
Wow.
So it was,
Good. So you used you had the yoga, you had the information from the books, you practiced relaxation, and you used some alternative therapies like reflexology.
Yes.
Brilliant. So with in terms of finding out more about the C-section or VBAC, where did you go to for information?
So the first place, or the procedure through the midwife, was that I was referred to the antenatal clinic at the hospital, and they reviewed the labour notes from my oldest daughter's birth, and they took the notes out, and the midwife sort of reviewed them to see if there was a medical reason why things hadn't progressed with that labour, and which resulted in the emergency C-section. So when she was reviewing those notes, she couldn't see a medical reason as to why things hadn't progressed. And it was a 26-hour labour, and I only progressed to 4 centimetres, so it was a long time with lacking in progress and some complications along the way. So there was no medical reason for that to have happened. So the option of elective section was there, but also VBAC was also there, presented to me as the alternative. So that was the antenatal appointment, and then shortly afterwards I saw an obstetrician consultant who went through what the risks associated with either option were. So what would happen for elective C-section, the risks, what would happen with VBAC and the risks, and the focus for them was on rupture of my existing scar in the scar tissue during labour. So that seemed to be the main risk.
The main concern.
Maybe. Yeah. So with that in mind, they've given me sort of information around about if I did progress into a VBAC, what their medical preferences would be, and that was going to the labour ward. There was talk of induction and augmentation of the labour had it not progressed, and for me that didn't sit comfortably with the experience I'd had before. So I knew that I didn't want to be induced. I didn't want to have any augmentation of my labour, and I was quite keen that the baby arrived when it was ready to arrive, so that having a C-section early also didn't sit comfortably with me either. So from the medical point of view with the midwife and the consultant, that was the information I was given. But I was also referred to AIMS guidance and NICE guidance about high risk labours and whether you have to have the augmentation and such like. So in my head, I was trying to weigh up the risks, the medical risks, with how I wanted the birth to be managed.
And did you find seeking and learning about all of the aspects and the pros and cons was helpful later on?
Yeah, definitely helpful to get my head into a place where I was prepared for either of the eventualities, because I couldn't decide, to go for an elective section.
No.
Or I didn't know, definitely I didn't want one. So to have the information to make a birth plan that set out, all of the different options, my preferences for each scenario. But I don't think I could have done that without knowing the alternatives to the medical advice and risks that was presented to me at the same time.
Okay, so you really equipped yourself with lots of knowledge.
Yes.
So that either way you'd have felt more prepared.
Yes.
Yeah.
Yes.
Good. And so when birthing did come, which way did it go, and how did it work for you? How did your birthing play out? Tell us about that, Arlene.
So Eula was born at the maternity hospital in Aberdeen by emergency C-section. When I went into labour on the Thursday morning, I woke up and I just had that, crampy feelings that I thought, this is familiar. I think things are, progressing. But that was 39 weeks plus 1 day, and my appointment for the elective section was the following day.
Okay.
So it was a spontaneous labour.
Right.
So because of the VBAC and the risks associated with that, and I discussed it with the midwife and the consultant that my preference was not to go straight to the labour ward. I'd like to stay at home for as long as possible, and ideally go to the maternity unit at Inverurie rather than going to Aberdeen. And although that was against the guidance I was given, that for me
was your preference.
Yes, that's
at the
where
time.
I would feel less anxious about giving birth.
Yeah.
So I phoned the midwife's unit in Inverurie to let them know that I was in the early stages of labour. She asked if I was happy to be at home, which I was. My oldest daughter was still home, so it was nice to spend some time, with her, keeping things relaxed. But I phoned my husband, who'd gone to work, and I said, I think you might need to be thinking about coming home around lunchtime. So kept things relaxed as possible. Played with my daughter, got her ready for nursery. Nice. When she went to nursery, my husband came home. I went for a bath because things were I could feel it was sort of progressing and picking up. So I went for a bath, listened to the meditation, and it was nice just in the bath where it was warm, and just relaxing.
Supported, I
but
suppose.
as I felt relaxed, I could just feel like the contractions were getting more frequent, and a little bit more intense. So I phoned back to the Inverurie maternity unit, and they had said, phone after lunchtime and let us know how you're getting on.
Yeah.
So I'd phoned back, and the midwife there was like, come up, get yourself ready and come up, and we'll do some checks.
Yeah.
See how you're getting on, and we can decide if you're able to stay here or whether we have to think about going to Aberdeen. So got my stuff together. We went up to Inverurie, and that was maybe back of 2.
Right.
And the midwife did the usual checks, blood pressure, and was timing the contraction. So at that point, I was 3 contractions in 10 minutes, lasting 40 seconds each.
Okay.
And felt very relaxed about everything. And I think that's because I had been allowed to stay at home.
Yes.
And you've
just got into that zone of feeling relaxed, and so that you were able to take that with you then into the next stage.
Yeah, and you're just sort of breathing through the contractions, and it was lovely. It was fine.
Good.
So she had said, I think we maybe need to have an examination to see how far along you are.
Yeah.
So with my daughter, I'd only ever gotten to 4 centimetres. So although I was happy for her to examine me, I said, don't tell me if I'm not 4.
Okay.
Because I think that'll just,
set you back a bit
set
mentally.
your mind racing, yes.
Yeah.
So she examined me but didn't tell me how far along it was. So I didn't know.
Good for you.
And
that's very brave.
And shortly after that, my waters went. And of course that made things pick up a little bit more. And before we could decide whether I was for staying at Inverurie or going to Aberdeen, they listened into the baby's heart with the Doppler. But it was decelerating too much on contractions and not picking up quick enough. And that is the same situation I had with my oldest.
Right.
So it was familiar territory, but obviously put the whole birth in a different picture because of the low heart rate. So the plan was to go to Aberdeen.
Okay.
So got an ambulance.
Yes.
My husband set off to Aberdeen first whilst I was waiting for the ambulance. He was on his way. I was following shortly behind him, and we were going to theatre.
Right.
That's what I'd asked for. I said if there was any distress of the baby or any, abnormalities, I just would rather go for a C-section and not try to progress
Because you'd
with
already
the labour
prepared
itself.
for that option as well.
I had, yeah. So that was my birth plan, that, any complications, let's just go straight to theatre. So the theatre team was being prepared whilst I was being transferred.
Okay.
So when we got to Aberdeen, I was put to the labour ward first, so they could do some checks on the baby, the heart rate, to see how things were for giving birth. My husband was being prepared, scrubbed up for theatre. So I was in the labour ward, not for very long actually, before we went to theatre. It was maybe only about 20 minutes or half an hour.
Yeah.
But the priority for the midwife team was to get the trace on the baby's heart rate, which they couldn't get. So there was a lot of people in the room trying to,
assist.
Yes, have it was busy. So I asked for all the questions to be directed to my husband, so they could concentrate on getting the heart rate, and I could just close my eyes and breathe. Yes. Because I had thought I was going straight to theatre, so going to the labour ward was, different to what I thought was happening, but they had to make these checks. So, so whilst that was all going on, and they were trying to find the heart rate with the, around my belly, they couldn't get the trace, so they wanted to put the monitor on the baby's head.
Okay, yeah.
So when I got to Aberdeen, I was examined, and I was still 4 centimetres as I was when I left Inverurie, and still familiar territory. But when they were putting the clip on the baby's head, it turns out I'd actually fully dilated in the 20 minutes it had taken them to get all of the machines and paperwork together.
So you must have stayed incredibly relaxed despite the transfer, despite the intervention, despite all that was going on.
Yes.
Amazing.
So I for me, it was concentrating on staying calm.
Yes, which you clearly
because
did.
The complications, I think, because of my previous experience with my oldest, it was almost familiar. I was like, well, this was probably in the back of my mind, expected to happen. So I was able just to allow the midwives and, the doctors to do what they had to do. But I thought there's no point me getting into the panic like everybody else is. I just shut my eyes and concentrated on the breathing.
Good.
But what they'd also established, that I was fully dilated, but also the baby had turned back to back, and by this point I was losing blood on every contraction as well, which was similar to my oldest. Exactly the same, except this point I was progressing so quickly, whereas with Orla there was no progress at all. So there was a question at that point whether there was time to operate. Was there time to get me down to theatre and have the anaesthetic put in? But a decision was taken, let's go down to theatre. And when I got there was one last chance to try and deliver her before they operated, but she was too far up the birth canal. It would have taken a wee bit of time to get her out, and they weren't happy with her heart rate, so very quickly operated, and she had a wee puff of oxygen. Aww. And then she was right as rain.
She was right as rain.
So
good.
It was from arriving in Inverurie 3 hours all in, and only half an hour from getting to Aberdeen before she was born, so very quick. Yes.
And it sounds, it was an interesting experience, wasn't it? There's lots going on.
Yes.
And so I know that when you receive your baby, that's obviously the best part.
Yes.
But what bit really stands out for you that you're really proud of, that you kind of managed in your birthing experience?
Aside from meeting the babies that you've grown and sort of gotten to know this bump for 9 months, and meeting the baby, that was lovely. But for me, having been able to stay at home and have time with my oldest whilst I was in that early stages of labour, I think she helped me be relaxed. She was so excited to meet her little brother or sister that she knew that shortly she'd be meeting this person that she'd been so excited to meet. So I think that was a highlight.
That's lovely.
And I think just being able to stay so calm and relaxed despite all that was going on around me, and being able to get to the stage where I was fully dilated, which I didn't think was perhaps physically possible for me, owing to Orla's birth, of no progress. Yeah, I was.
So there's a sense of achievement also in getting as far as you did.
Yes.
Yeah, really good.
Yeah.
Do you have any tips or advice for mums that are expecting or new mums that you would pass on?
Tips for new mums, I think I would just try and relax, because there's, it's brand new having this tiny person to look after, but I think, just try and go with the flow too much. Don't worry about things or try not to be anxious. Just, stay relaxed and, let the baby, lead you. They'll tell you when they need to be fed and, just, go with it and try and make time for yourself every day if you can. Even if it's just 5 minutes, or,
just remembering that you're a person as well.
That would be the tips. Yeah.
Good. Well, thank you very much, Arlene. It's been lovely hearing your story.
Thank you.
Congratulations on your new baby daughter,
Thank
Eula.
you.
Thank you.